This segment of DelmarvaLife is brought to you by Delmarva Dental Services.
According to the American Dental Association, there is no one-size-fits-all when it comes to dental treatment.
Some people are fine with going only once or twice a year, while others may need to go more often. But I think we can all agree that you do need to go. Unfortunately, fear can prevent some people from doing just that. DelmarvaLife Sean Streitcher stopped by Delmarva Dental Services to learn about sedation dentistry and how it's helping people with a fear of dentists keep their smiles looking great.
Chances are, if you ask someone why they go to the dentist, they'll say to take care of their teeth. But by not going, you could be affecting way more than just your mouth.
Anytime you have infections in your body, whether it be a gum disease or whether it be an abscess, you have increased bacterial level in your bloodstream. And that bacteria affects other organs. It can affect your heart. It can affect, if you have artificial joints and things like that, those bacteria in your bloodstream from your mouth can seed into those areas.
Knowing this, you would assume that everyone would just go to the dentist, but that's not the case. Dr. Joseph Harmon from Delmarva Dental Services says fear is one of the top reasons why people don't go. That's why they say they do everything they can to put your nerves at ease.
We have a anti-anxiety questionnaire that we have online, and the main cause is lack of control, fear of not being in control. And then there's secondary things like the sound of the drill is a big one, a needle is a big one. Some people are upset because they've been lectured in the past and yelled at, so they're embarrassed.
That questionnaire can help your dentist know what not to do.
We ask particular issues that they're afraid of. There's about 20 questions, specific things that we can key in on. So quite frankly, we don't do those things like lecture, you don't lecture the patient, or sounds, we'll use headphones. A lot of patients are afraid of not being numb enough. And those people, you have to really ensure that you're using enough anesthesia, and you reassure them that you're using enough anesthesia, and you go slow because they're in the back of their mind, they're thinking, it's going to come, it's going to come, it's going to come, you know. And so you treat everyone custom, individually.
Another thing the questionnaire is used for is to rate your anxiety level.
Actually, we rank them from 1 to 20, depending upon how they answer questions. And anywhere from 1 to 10, they pretty much don't need anything.
If you fall in this range, you can sit back, watch some TV, and let the dentist work. Once you pass a 10 ranking, that's when you might want to start thinking about a deeper way to ease your concerns.
The first level would be a tranquilizer. Maybe somebody that was, say, around 10, 11, 12. Maybe some valium an hour before the appointment. And then we also have laughing gas or nitrous oxide if they need a little bit more. So the closer you're getting to 15, then you may need a little bit of laughing gas as well as the valium. Then when you're around 15, maybe you're going to need a short-acting sleeping pill. We'll put you not totally asleep, but semi-asleep.
When you start getting closer to 20, you may need IV sedation.
You take a pill, it takes a while to work. Do IV, if someone needs a little bit more, you just put a little bit more in and it works right away.
If needles are what's keeping you from the dentist in the first place, this cool device might help. Dr. Harmon says it helps them find veins, lessening the chance you'll need to be stuck twice. And while sedation dentistry is just for adults, there are a few things parents can do to help with their child's fears.
Sometimes parents mean well, and the kid's not expecting anything, and if you say something like, it's not going to hurt, well, the kid never occurred to him that something was going to hurt. The fact that you say it's not going to hurt is just put that in his mind.
By helping your child build a good relationship with the dentist, Dr. Harmon says you're helping ensure they'll go as an adult.
Most of the adults that are afraid were traumatized as kids, and it's much easier to treat them right when they're kids.
But according to Dr. Harmon, the best way to ease a patient's fear is by showing them he cares.
If they know that you care, and they generally feel that you care, then that puts them way, way at ease.
Dr. Harmon says in some cases his patients will start out needing to take something to ease their anxiety, but over time they become comfortable and no longer need to take anything.
You know, I got to tell you, something I really enjoy is a good dental cleaning.
Yeah?
It just feels so good afterwards. And guess what? Dental care isn't just something for us humans. dogs and cats need it too. Did you know that many of our dental problems that we as humans face affect our four-legged pals as well? The thing is, we complain about a toothache. Our dogs and cats have a higher pain threshold, so they act like there's nothing wrong. Here now, thanks to our friends at CBS.com, are ways you can tell your pet needs a professional checkup. Sometimes dogs need a dentist. This 8-year-old Chihuahua named Albert is in for a cleaning.
He's a little on the small side, tiny, so we have to be careful with our smaller patients.
Listened to Albert's heart. We've done a blood test, and Albert is perfectly healthy.
Dogs don't usually get cavities, but about 85% of canines over the age of 3 have periodontal or gum disease, and their owners don't always know it.
Dogs and cats have a very high threshold for pain. So very often the most common sign of serious dental problems in dogs and cats is no sign at all.
Cats can also have dental issues.
We don't know what causes these, but studies show up to 72% of cats are going to get these painful cavities called tooth resorptions.
In some cases, pets may need orthodontic help. Yeah, braces, caps, crowns, even Invisalign, specially modified for their mouths. Braces for pets are not just cosmetic.
Dogs don't care about aesthetics, and we don't care if the dogs don't care. But what we do care about is if orthodontic problems are causing health problems.
Health problems like sharp teeth poking into the roof of a dog's mouth, which can be corrected. Pets need to undergo anesthesia each time they have dental work done, but advances have made it much safer.
They take at least 2 hours to fully recover. He's waking up beautifully.
What I hear all the time in my practice is a pet that no one ever knew it was having a problem until after we fixed it. And then we hear, wow, my cat is like a kitten again. My dog is rejuvenated.
Dr. Carmichael also says it's important to make sure that pets get their teeth examined by their veterinarian at least once a year, ideally twice a year. Vets can make recommendations as to whether or not the pets need additional professional treatment.
Well, you know, a big part of being a pet owner is accepting that these animals, no matter how precious, can cost a lot of money. But if you are looking for a new family pet, Sean's got you covered.
Well, Lisa, I don't think Pippa would mind being that new pet. She's been here at the Eastern Shore SPCA for 2 years, and she's ready to go home. Up next, I'll introduce you to her.
One pup traveled across land and sea to arrive at his new forever home. After the break, we're going to meet Nick, a German Shepherd puppy from Sochi, Russia, now living his happy ending. DelmarvaLife will be right back.